In less than 30 hours, Melburnians will be forced to wear a face mask when they leave home or cop a fine. It's the latest enforced order to help curb the deadly second wave. And not surprisingly, it's caused panic buying.
We have 6,289 cases of coronavirus in Victoria. That's 374 new cases.
On the issue of masks, I just want to reiterate they are a significant additional measure that we can take.
There's no vaccine and there's no cure. Now we're being told to mask up.
Look, it makes it a bit difficult, but if that's what we have to do, that's what we have to do.
If you don't wear a mask, you cop a $200 fine, and do you think it's worth it?
We are getting too much paranoid, I think.
I'm sorry to have to inform you of 3 further deaths, bringing the total number of fatalities due to this virus to 42.
From just before midnight on Wednesday, masks will become mandatory in Melbourne.
Yeah, the earlier you bring mask wearing in, the earlier you will interrupt the transmission and the smaller the ultimate epidemic will be.
The most important thing is that the mask should be reasonably well fitted. Fabric masks are fine as long as they're washed. Single-use masks are single-use.
Thankfully, there's lots of masks to go around for everybody, which is good. We're having, and we continually will have, a steady supply daily, which is good. So everyone will come in and hopefully get what they need.
We are going to be wearing masks in Victoria and potentially in other parts of the country for a very long time.
Since Premier Daniel Andrews made the announcement on Sunday, within 24 hours, Victorians bought at least 1.5 million face masks from Chemist Warehouse alone. Pharmacist Ismail Arakji.
We're restocking those every day with daily deliveries, so it's a steady supply, which is good.
The demand has been overwhelming. We launched our online store last week for the face masks, and within minutes they had sold out. Within the first 48 hours, I think we sold 1,500 face masks.
Kate Coleman is the CEO of The Social Studio. The not-for-profit organisation has been making masks for weeks.
Because the demand has been so overwhelming, we are immediately looking into scaling up our workforce so that we can make more masks and help more people.
Others are getting creative in their bid to cover up, from cutting up socks to pulling out the sewing kit. Do-it-yourself face masks are also trending online.
I absolutely love this idea.
People are lining up to get their hands on fabric, elastic and sewing machines at retail stores.
Can't sew, never sewed anything before. Worth a red hot go.
I think I've got an order of quite a few people, probably about 15 people plus, so I think I'll be making 3 each for all of them. Getting busy.
I'm looking forward to making some. It'll be something to do whilst it's raining and we're stuck inside.
The masks are just another level of action, another level of potential protection, but it's not the be-all and end-all, and it shouldn't make people complacent.
Infectious disease expert Professor Mark Pellegrini.
The whole premise is that the mask is actually stopping the virus getting to your mouth, so it'll sit on the outside of your mask. So if you touch the outside of the mask, you might have virus on your hands.
Despite the science and medical support, there's been a clear backflip.
There is an ongoing debate about the use of masks at the community level.
Wearing masks like that is wasting a mask.
If the mask theory is wrong, then people have unnecessarily worn a mask.
So who should we believe?
Oh, everybody needs to wear the mask outside, walking down the street, it's crazy.
I think the pressure of being fined for it is too far.
Lucia and Chili are mums from inner city Melbourne.
It's completely not human behaviour. That's what I really think.
I think it's really scary how quickly everybody's willing to give over those freedoms.
But the message from health professionals remains clear. Victoria's Chief Health Officer, Professor Brett Sutton.
It's a small sacrifice that we make. It's a small constraint on our liberties, if you like, but it's a really important one because there is no greater loss of liberty than the loss of your life.
There's just over 24 hours before wearing a mask becomes mandatory for more than 5 million Australians. But you don't necessarily need to go out and buy one. An old footy scarf lying around home or a bandana will do the trick, as long as when you're wearing it, it covers your mouth and nose. There are a range of circumstances you won't be legally required to wear a mask. Infants and children under 12 years of age won't have to, or if a person has a relevant medical condition.
Teachers and sports people won't need one while working, and you won't be fined if you take off your mask to eat, drink, or take medication.
Wearing a mask is a small thing that everyone can do that'll make a big difference if enough people wear it.
Professor Raina McIntyre is an infectious disease expert. She believes people in New South Wales should be wearing masks too.
Yeah, definitely. From a public health perspective and a prevention perspective, there'll be more impact. We don't want to have a lockdown in New South Wales, and one way of potentially averting it is if everybody wears a mask.
From Thursday, customers at a range of Victorian retailers, including Bunnings, Kmart, Target, Myer and David Jones, will no longer be allowed in store if they don't wear a mask.
It's a government mandate, and so therefore these shops should be taking the precaution of making sure that customers who come in are respectful of the other customers who want to be protected, and therefore I think it's probably the right move.
Look, I think every little bit helps, right? So if we just all chip in and do what the health professionals advise us to do.
I don't like the feeling of a mask on my face. I feel claustrophobic in the thing. However, I am prepared to obey the law.